Hi, everybody. I'm Dr. Robert Hedaya, and I'm here with Kat Osorio, our nutritionist, and with our nurse, Brodi Alt. We're going to talk today for about 10 or 15 minutes about eating disorders and about a kind of unique approach that we're taking here at the Whole Psychiatry and Brain Recovery Center. So why don't you both introduce yourselves just very briefly, and then let's jump into the discussion. Kat, go ahead. Kat, you go ahead.
Okay, I'm Kat Osorio. I'm the nutritionist here, and I have a strong interest in this area. So I think that this will be an interesting discussion for us to have.
I'm Brodi Alt. I'm the nurse here at Whole Psychiatry, and I have a few things that I will mention later on.
Great. So Kat, why don't you start with, you had some thoughts that precipitated us doing this little video. Why don't you start with what you were thinking about and we can have a discussion.
Okay, great, thanks. So the number one question that I did have was, here within the functional medicine paradigm, we, as a nutritionist, I would typically recommend different diets that may involve eliminating foods, things, basically altering your diet in a way that people that are affected by eating disorders already are doing. And so we can't really do that. That would be counterintuitive to healing. So my question was, what approach do we take with these people when we can't take the typical kind of involving the nutrition as part of the whole aspect?
Okay. Well, so what I wanted to say in response to that is that we kind of take two approaches. One approach, which is functional medicine, which is trying to reduce inflammation, because eating disorders are related to OCD. There's an obsessive quality to the eating disorder, the compulsive quality to the eating disorder. They are also related to a mild form of bipolar disorder, but they're very related to the OCD spectrum disorders. And so when it comes to that, it's very difficult to intervene because of the OCD. And one way we can help is by reducing inflammation. And the core case, which I won't go into too much detail, was a 18-year-old guy who had severe OCD, hadn't bent his finger wasn't an eating disorder, but he hadn't bent his finger for 2 years because he thought if he straightened out his finger or bent his finger, that something terrible would happen. Then it turned out basically he had 5 infections causing inflammation, which disturbed his serotonin and zinc metabolism, and treated those. And within 3 months, he was all better, back off to school, etc. So we like to look at inflammation because that can drive the OCD. But the bigger innovation really is that we can actually now do something we couldn't do a few years ago. We can actually work inside the brain using neurofeedback, strengthening and rebalancing the neural pathways that affect people, that including parts of the brain like the anterior cingulate. So this is a passive treatment. The patient doesn't have to do anything, and we can actually rebalance the pathways in the brain. And sometimes we can even use transcranial laser light therapy in the brain to work inside the brain to straighten it out. So then what happens is the person is thinking, well, hey, wait, you know what? Maybe what I'm thinking about doing doesn't really make sense. They start to be able to reflect on themselves. And Brodi, this kind of gets to your point of what your experience was. Maybe you can share that.
Yeah, so I was on stimulants for 10 or 11 years due to difficulties concentrating. And so they had really diminished my appetite. I was very thin for pretty much that whole time. Happened very quickly after starting, and I had no appetite. So of course, being thin, pretty thin for that long, made the change of coming off of them kind of a little difficult to deal with. Society tells us a lot about intake, and like, you're not supposed to eat a lot. Although I knew I was supposed to be eating more, that whole thing was a big factor. And then once I was off of them, also shopping for bigger clothes was kind of something that I wasn't expecting. Even though I knew it was what I needed, it was what my body needed, is what I had been wanting for so long. It was just still a difficult transition. And so I had to kind of stay on top of that and like remind myself that this is okay. This is what you need. This is good.
In
So,
spite of the desire not to buy the bigger clothes, you were able to stop
Right.
and say, wait, this is what I need to do, right?
right.
So that takes me to what I was talking about, the area of the brain we've talked about the precuneus, which is your self-awareness, right? And so your precuneus is working, you say, well, I kind of want to do this, but it's not really necessarily good for me, or I notice that I'm wanting to do this. And there are other parts of the brain, it's not just the precuneus, but we can identify those areas that are causing dysfunction in awareness or ability to control impulse, et cetera. And we can actually modify those areas using neurofeedback or laser, and other techniques. So that's, I think, the new take. That's what we do here differently, is we can kind of do an end run around doing that battle, around the anxiety, and really it doesn't take much from the patient, because the brain knows when you give it the signals and the energy, it knows what to do with it.
Right.
So that's I think an answer to your question.
Yeah. And then another thing, not so much a question, but more of, I guess, a comment or contribution would be just, I think, the importance of a care team. So it would encompass us here, but then also a therapist that can help the patient work through the psychological, maybe there's trauma at the root of it, or like Brodi was saying, there's a lot of expectations, I guess, that society just puts on us, and working through that with therapist, with the nutritionist, with body image and that sort of thing, just as an all-encompassing approach.
I think it's very important. What you're saying is very important. Now, that
Yeah.
example of that patient I told you, the guy with the finger and the OCD, it turned out that the father was having an affair with someone, and kind of everybody in the family sensed it, whether they knew it or not. And there were underlying stresses, let's say, and anxieties in the family that maybe this guy knew of, but was afraid to even think about. So before we stopped, I think hopefully this has been fruitful. One picture is worth 1,000 words. I have a picture here I want to show people so they can see what we're talking about. So I'm going to share my screen shortly here, and let's see, I'll show you what we've got here. And here we go. So this is an example of what we can do. We can do this test called a quantitative EEG in your own home or in the office. And we see these different networks. In this particular case, we're looking at these neuronal connections. This is the front of the brain, the right side, left side front of the brain. This is temporal and parietal lobes towards the back of the brain. And these blue lines indicate a poor connection between these areas here. And this particular network here that we're looking at is the salience network. And in this case, you see it here outlined. There's little faint white lines here. You might not see all of it, but we can see whether the salience network is working properly. So the surface of the salience network is gray. That's normal. That's all fine. But the connections between different parts of the salience network are not working properly. And then after we treated this person, you can see that the salience network is completely normalized. So that's an example of what we're talking about, working inside the brain and correcting the networks and the imbalances in the brain. So that's what we've got for today. Hope this was helpful, everybody, and have a great day. Thank you very much.